Can new TKIs overcome resistance in chronic myeloid leukemia? Imagine battling a disease that keeps changing its defenses. That's what happens in chronic myeloid leukemia, a type of blood cancer caused by the BCR-ABL1 fusion gene. This gene produces a protein that makes the leukemia cells grow out of control. The main treatment has been tyrosine kinase inhibitors, or TKIs, which block this protein and keep the disease in check. But resistance can develop, making the treatment less effective over time. So, can newer TKIs help overcome this resistance? First, it's important to understand that resistance often happens because of mutations in the BCR-ABL1 gene. These mutations change the shape of the protein, making it harder for TKIs to bind and do their job. The first TKI used was asciminib, which revolutionized treatment. However, some patients develop mutations that make asciminib less effective, especially the T315I mutation, which is known as a gatekeeper mutation. To address this, scientists developed second-generation TKIs like dasatinib, nilotinib, and bosutinib. These drugs are more potent and can target many mutations that resist asciminib. They can induce faster and deeper molecular responses, meaning they reduce the leukemia cells more effectively. Then came asciminib, a newer type of TKI called an allosteric inhibitor. Unlike others that compete at the ATP binding site, asciminib binds to a different part of the BCR-ABL1 protein, called the myristoyl pocket. This unique binding allows it to inhibit some resistant clones, including those with the T315I mutation. Despite these advancements, no TKI has yet shown a clear survival benefit over asciminib in large studies. Asciminib remains a well-established, safe, and effective option. Newer TKIs do have side effects that need careful management, and their long-term benefits are still being studied. Resistance mechanisms are complex. Some mutations can make the leukemia resistant to multiple TKIs, including asciminib. For example, certain insertion mutations can alter the kinase's shape so that even the newest drugs cannot bind effectively. Interestingly, some TKIs like dasatinib may still work against certain resistant mutations, but not all. Research is ongoing to find better ways to overcome resistance. Scientists are exploring combination therapies, such as pairing TKIs with drugs that target other parts of the leukemia cells. For example, combining asciminib with agents that disrupt cell cycle regulators like WEE1 shows promise in preclinical studies. These strategies aim to attack the leukemia from multiple angles and prevent or overcome resistance. In summary, newer TKIs have expanded the options for treating resistant chronic myeloid leukemia. They can be effective against many mutations that block older drugs. However, resistance remains a challenge because of the diversity of mutations and the complexity of the disease. Personalized treatment, based on mutation testing and close monitoring, is crucial. While new drugs and combination therapies hold promise, they are still being studied. Patients should always work closely with their healthcare team to choose the best approach for their specific situation. Advances in understanding resistance give hope that future treatments will be even more effective in controlling this disease.